Hi, and welcome to this Friday's 5-minute consult with your favorite family medicine doc. In these videos, I discuss everything that you need to know on some of the most common health conditions listed from A to Z in 5 minutes or less. And today's topic starts with the letter G. So let's talk about gout. Hey, that rhymes. What is it? Gout is actually a form of an arthritis, and it occurs when you have too much of something called uric acid within your bloodstream. This uric acid is responsible for forming sharp, small crystals within your joints. One of the most common places that people experience this gout arthritis is within the big toe. However, it can also occur in your elbows, hands, wrists, foot, or ankles. Gout attacks are usually sudden, and they can cause some serious pain, swelling, and redness around the area that is affected. It usually can last anywhere from 3 to 10 days, but the first day or so is typically the most painful. After the first attack of gout, some people don't get it again for months or even years later, but some people can have it recurrent and often. Who is at risk for gout? Gout usually affects men more than women by 3 to 1. Men are more likely to get gout after the age of 40, and women are more likely to get gout after the age of 50. Certain risk factors for gout include being overweight or drinking excessive amounts of alcohol, having a family history of gout, taking certain diuretics, otherwise known as water pills, to help treat high blood pressure, which can actually increase the uric acid within your blood. Other medications used to treat rheumatoid arthritis or psoriasis can lead to gout. Having high blood pressure, high cholesterol, heart disease, or diabetes, or if you have had a history of gastric bypass surgery, you are also more at risk for gout. There are also certain foods that increase your risk for gout because they contain something called purines. And uric acid is a breakdown product of purines, so the more purine-containing foods that you're eating, the higher chance you have to develop more uric acid and therefore more chance of gout. What is the cause? Like we talked about, gout is caused when there is an excess amount of uric acid, and uric acid is used to help break down purines. So if you're eating more of these purine-containing foods, then your body is working harder to make uric acid. These foods include things like red meats, different game meats or organ meats, certain fish or shellfish, even some vegetables including asparagus, and drinks containing high amounts of sugars including sodas or juices. In some people, their bodies just make more uric acid or has trouble excreting their uric acid, and that is based on genetics. The excess amount of uric acid forms small crystals. Those crystals end up and deposit into joint spaces, and therefore they can cause a gout flare-up. What are the symptoms? In areas or joints that are affected by gout, you're going to experience a lot of pain, swelling, and redness. Gout can also sometimes form lumps that look fairly disfiguring, and these are called tophi, and they are represented by painful bumps or lumps on the skin. Diagnosis. If you are concerned you may be having a gout flare-up, you will want to see your doctor. Your doctor is going to ask you about the symptoms you are having, ask if you have any history of gout, and on physical exam, if they see a joint that is very swollen, painful, and red, as long as they rule out any other types of infection, they will be able to conclude that your symptoms are due to gout, especially if your symptoms are located in the classic area where gout affects, which is the proximal joint of the big toe. If uric acid crystals accumulate in the urinary tract, you can also experience kidney stones. What is the treatment? The main treatment of gout is going to be with anti-inflammatory medications. These include things like ibuprofen in the prescription dose. Your doctor may also offer you a short course of steroids, including a Medrol dose pack or prednisone, to also help reduce the inflammation and pain around your joint. If your gout flare-up is located on your great toe or your foot and it's causing you trouble to walk, then your doctor may offer you crutches to use in the meantime until your pain improves. Working in urgent care, I have seen many patients come in experiencing gout. Most of them were men, but I have seen women with gout as well. The one thing that they all tell me is how extremely painful it is, and even anything that touches the area can send them through the roof. Having seen this or meeting these types of patients, I empathize with anyone out there who may be experiencing gout or who has had a gout flare-up in the past. My best recommendation would be to try and stop the gout flare-up from happening in the first place, which brings us to prevention. If you are one who experiences gout or has gout flare-ups, you want to be avoiding those foods that we talked about, including red meats, game meats, certain fish products, sugary drinks, or alcohol. If you can avoid excess amounts of those types of foods, it should help you prevent a gout flare-up in the future. And that wraps up our discussion today on gout. I hope that it was helpful and informative for you all. If you have any further questions, please let me know in the comments section. I would be happy to answer those for you. If you would like to see more educational videos like these, be sure to subscribe, as I am posting new videos every Friday. And I will see you on the next video. Until next time, bye!